Welcome to the LHP podcast. My name is Marcelo, and today we're going to talk mental health and lifestyles. Today's first guest is a dear friend of mine. His name is Dr. Flores, MD. I really want to make sure that I get all his information and credentials up to par because it's important that those people that are watching understand that this is a person that's done a lot for our community, and he deserves all the respect possible. So here's a little bit about Dr. Flores. He's a native of our border complex, being completely bilingual and bicultural. Dr. Flores understands the idiosyncrasies of our communities like no other. Dr. Flores has an extensive experience in both the inpatient and outpatient settings within psychiatry. He's an expert in treating anxiety, mood disorders, post-traumatic stress disorder, and severe mental illnesses, including substance abuse and disorders. Dr. Flores is certified by the American Board of Psychiatry and Neurology and holds an assistant clinical professorships of psychiatry at Texas Tech Universities and El Paso, Texas, and Bureau College of Osteopathic Medicine at Las Cruces, New Mexico. Dr. Flores is active in promoting mental health issues, lecturing at the local universities and community college, and through his social media platforms. It is my honor today to have Dr. Flores be our first guest in the LHP podcast. I'm really excited at the fact that you're my first guest here at the LHP podcast. And for those that are probably watching this, they're thinking, well, what does LHP stand for? It stands for Love, Health, Prosperity, El Paso. And the focus of that website is pretty much to encourage family and relationships and mental health and things of that nature. So it's a wide variety of different things that I decided to do with this website. And the reason why I decided to do it here, because a lot of people are probably wondering as well too, why at a skateboarding shop? Well, these are my roots. This is what I grew up in. I'm originally from Los Angeles, California, and I began skateboarding when I was 7-8 years old. So these are my elements. This is something that, ever since we opened up this shop in 2004 as a family, we had a lot of people coming in and out of the shop. And we have a couch right there where people just get to, sit down sometimes and just converse and be relaxed and enjoy and disconnect from everyday life. And skateboarding has always been a lifestyle for a lot of people that tends to make them feel, at home coming into a skate shop, relaxed. And I felt that touching upon issues that are difficult, that are stigmatized, that people don't really like to talk about, such as mental health, such as severe mental illnesses. I think this opens up a brand new platform for people to understand that we want to take a different approach. It's not just certain people that get, that get stuck in situations that are questionable. It could be anybody from any walk of life. So how do you approach these type of things? Well, I think the answer to that is making sure that we have a casual conversation about different situations here. Now, I'm totally excited at the fact that you're here with us today. And I really want to talk to you about what it means for you to be in the mental health field and how you actually ended up in the field yourself. So, like I said, I'm super stoked at the fact that we're having this conversation, you and I, right now, and I'm super stoked at the fact that we're able to transmit this information to people who really need this.
No, thank you, Marcelo. It's truly an honor for me as well. Like you said, your shop is amazing. I don't think I have ever been here before.
Okay.
And I really feel the same way that you do in terms of these mental health issues, especially now. After all the things that we've gone through in the last couple of years, the pandemic that's still kind of lingering and whatnot, I think it's very important, like you said, to feel comfortable, to feel open about the fact that we need to talk about these problems, in the most sincere possible way. Trying to get rid of that stigma behind mental health. There's really nothing wrong approaching, your doctor, your therapist, whoever, even a family member or a friend, and say, listen, I'm not feeling that well. I think there's something going on. And why not, doing it in a place where you feel comfortable, like you said, maybe even in a skate shop,
Yeah, definitely. Shouts out to Jess, too. Jess is the one who runs the show.
Yeah.
Jess Bettis is you know, him and I opened up the shop back in 2004. He's my big brother.
Nice.
And ever since then, I mean, he's always been big and passionate about skateboarding. He's a big punk rocker too. So we're in the culture, and we've always been the type to you know, always feel comfortable in that subculture. Right. And when I told him about the project, he's like, "Yeah, do it, man." And the skate shop is a perfect place to do a podcast like this, for sure.
No, and going back to your question in the sense of what drew me into psychiatry, you know, I never knew that I wanted to go into psych myself. Growing up, I always wanted to be a physician, a doctor, because of my dad. He used to practice gynecology. He's now retired. I always had it in my mind, well, I want to go into medicine. You know, just seeing him when I was little, you know, he's my idol, basically. So then when I was in medical school, and the first clinical rotations that we have are within psychiatry, when you transition from the classroom to the hospital, the first one that you get is psychiatry. You go to the wards and you're like, oh my gosh, what's going on? And you see all these patients and their sufferings and their struggles. And I just fell in love with it, you know? And to me, what I've always said, and I know it might sound like a cliche, but when I talk to my patients, I feel that psychological suffering sometimes surpasses physical suffering, physical pain, because it never goes away if you really think about it. If you cut your arm or your leg, or if you break an arm or something like that, well, you put a Band-Aid and you do some, you know, cleaning, and with time it'll form a scar, right? Yeah. With the psychological pain, I mean, you can do the same through therapy and maybe with the help of some medicines, but it's going to stay there and it lingers and it's a little more stubborn, you know?
Yeah.
So
definitely.
when you really help in that way, it's a very big satisfaction to see a patient go from point A to point B and, you know, get over difficult situations, like you said. It's really quite amazing. So,
well, one of the things that kind of caught my attention with what you said right now, because a lot of people may have this question right now, the difference between psychiatry and seeing a counselor, a therapist, or a psychologist. Can you add a little light as to what that means for those that are a little confused by that terminology sometimes?
Sure. So I guess if we can make the distinction between, I mean, they're all within the same realm. You know, psychological care. Psychiatry has to do more with the biological component of addressing a symptom, meaning, you know, we use certain medications. We have the privilege of prescribing certain medicines that can help normalize mood, you know, level out anxiety, you know, getting rid of some disturbances like a hallucination perhaps. Through that route. At the same time, we can also provide some talk therapy to our patients in combination with that. Now, the other component, which is extremely important, is the therapy component, you know, through psychology, counseling. And that's basically, you know, how I explain it to my patients. You learn to, in a way, reorganize your thoughts, your feelings through talking to a therapist, through a professional. And you don't need maybe a medicine. You can do this on your own. When you're finding yourself, you know, in a tight spot, you can sort of pump the brakes and say, okay, I'm gonna relax for a moment. I'm gonna, you know, reorganize what's going on in my head, and, you know, move forward, you know, with your day in that fashion. So that's the main difference, I guess, the use of medicines within psychiatry and other psychosomatic strategies. You know, we have, you know, ECT, electroconvulsive therapy, but, you know, that's for very resistant cases of depression. More recently, we have TMS.
How does that work, though, as far as depression? How does that technique specifically work for depression?
So let's say that, you know, you have a patient that has been depressed for several months, several years. You've tried medicines, you've tried, you know, different antidepressants, you know, different anxiolytics, and nothing seems to work, right?
Yes.
Maybe they're to the point where they're feeling suicidal, they want to take their own life, they're in the hospital, in and out. At that time, you do an evaluation in the sense of, okay, why don't we try in a way shocking you. I know it sounds barbarian, but
Yeah.
it's really not. You're under
Yeah.
a professional anesthesiologist, so
Okay.
you're put down in a medical suite
Uh-huh.
under anesthesia. There's a psychiatrist there who's certified in doing that type of treatment.
Uh-huh.
And they put a couple of pulls, on your temples. They could be on one side of your head or on both sides. And they run a smooth electrical current
Okay.
through your brain. It's not like they poke a hole on you or anything. It's kind of like a jump start.
Okay,
If
okay.
it's a analogy there.
And I guess, and that's a good thing that you bring that up, because when we think about those things, or we hear about them,
Right.
we get a little concerned. We're like, what do you
Right.
mean you're going to shock me, right? But I think it's important for us to know, and that's in an extreme case. Would you
Correct.
say that?
Yeah,
Okay.
it's for cases of severe, treatment-resistant depression. And we use it for other, illnesses, but the main one is for depression.
Okay. All right. So there's a lot of things that are going on right now, especially during this time of month right now. We're transitioning into the cold season, right?
Correct.
A lot of people are concerned with things like you said, the pandemic and surviving the pandemic afterwards, and economy, things of that nature.
Political turmoil.
Political turmoil. We had
Right.
elections just come up not too long ago. And then all these other stress factors too. What kind of things do you see, or what kind of things do you recommend as far as, because that seasonal depression is gonna kick in? And I want to see if I can get you to talk a little bit about depression. What exactly does that mean, and how does a person know that they have depression?
Right. So if we talk about in the general sense about what depression really is, it's a constellation of symptoms, right? The more common ones is interruptions within our sleep pattern. Some patients say, I can't really sleep. I wake up recurrently in the night. I don't know what's going on. Some patients can't fall asleep, so they just stay up all day and all night. There's a loss of interest in things that you like to do. If you like to skateboard, maybe you're like putting it to the side. It doesn't really interest you anymore. There's some feelings of hopelessness, like sadness, melancholy, right? Some patients experience guilt. They don't really know what to pinpoint to for that guilt, but they just feel it,
Yeah.
Low energy levels, decreases in your attention span, and your appetite is, irregular. Some patients overeat, which I see a lot in the clinic. Out of comfort, out of anxiety, they're just overeating so much. So all these symptoms encompass depression, and they have to last for at least 2 weeks.
Okay.
Every day.
2 weeks.
In order for us to do the diagnosis. Now, you mentioned something super important in the sense that you're right. When we see the winter months, autumn, winter, depression can be more prevalent. And that has to do with the daylight. I know that we have the daylight savings.
Okay, so the time change is a big factor, you're saying.
Time changes because the less sunlight that we receive, our messenger system within the brain gets all messed up, goes haywire. So that by itself can put you in manifesting some of these symptoms.
Okay.
And the therapy sometimes is just using a light box, believe me, or in combination with some medicine, because you need that. You need that through your eyes, through your eyesight, for these messengers to kind of sort of rearrange.
Okay. All right.
Of course, it sounds simple, but if you're already struggling throughout the year, it makes sense also that during the months of winter, these things come up with a little more intensity because of these changes, like you said.
Definitely. Why do you think that people struggle to get help sometimes when it comes to mental illnesses? Why do you think it's such a big stigma in our border community?
Well, I mean, listen, I think we just spoke about it. Even the fact of hearing electroconvulsive therapy, what's the first reaction we get? We get spooked, right?
It's shocking.
I think a lot of it has to do with Hollywood sometimes, movies, TV shows.
Okay.
People are scared that, oh, you're going to label me as the crazy one. You're going to try to put me in the loony bin, but it's really not. It's the same thing. Maybe an easy way to see things is within mental illness, unfortunately, the manifestation of our symptoms have to do with our behavior.
Okay.
Right? And if you see someone behaving a little differently than you or your group, it's going to throw you off, right?
Just a little bit, depending on their personalities, right?
But if you come to understand it as symptoms, that's why I tell my patients, this is not you. I know that it's you manifesting them. You're behaving a little differently, but it's part of a problem that has a solution,
Yeah.
It's just a problem. It's like, we go back to the same examples. If you have high blood pressure, well, you can't really see high blood pressure in you.
You can't, no.
But if you take a reading, it'll come up, right? So you treat it, and you go about your day like nothing happens. But since in psychiatry it's behavior, I think that's why people, have a harder time. I don't want to go to the doctor. You must think I'm crazy.
Yes.
You must think I'm, weird. You're not. You're just going through a difficult time. That's it.
That could be something major for a lot of people. And I think that the medication factor is also a huge thing right now. What's your experience with prescribing medication to clients and being able to give them instructions? I mean, is it something that comes pretty much, is it a difficult thing to do, or do you find that clients are pretty compliant when it comes to taking medication sometimes?
Well, half and half. I try to work with the patient as much as possible. When we absolutely need medicines, we have to use them, of course. I was actually talking to some colleagues just not long ago from Texas Tech University, from the School of Medicine, and they brought up an excellent point. While medicines, the use of medicines are important, I feel like nowadays a lot of providers are just, pushing them, giving them away like they're candy.
Okay. That could be dangerous,
and that can
for sure,
be dangerous, We should be able to train our future generation of doctors, psychiatrists, to even de-prescribe medicines, use them sparingly, use them cautiously. Because it's not just about, sometimes a medicine is putting a little cover over a problem, but you have to actually talk to the person and understand where they're coming from, In compliance, that's the biggest thing. They tell me, Doc, who likes to take, 3-4 pills every single day? It's exhausting.
It is. It's exhausting, and definitely something that is I guess also the symptoms behind having to take medication too. I'm sure they
side
complain.
effects, like antidepressants. I see this all the time. People might not know this, but the biggest side effect is that they decrease libido. They decrease sexual, appetite.
That's a big issue.
And they tell me, Doctor, I come here.
Yeah.
My skin is crawling out of my anxiety is crawling out of my skin, and you prescribe me something to calm down, but then I can't have sex with my spouse. That gives me even more anxiety. Like you're creating a big problem.
Yeah, it becomes some sort of storm all of a sudden, right?
Yeah. So you have to be really careful.
How do you fix that, though, Doc? I mean, think about it. How do you really? You got somebody coming in with one thing, and then all of a sudden you prescribe a medication, and they come back, and then they tell you about something else.
Well, there are ways around it, biologically, in the sense of you use some medicines that might not promote that side effect as much, or you can use a second one to revert it. But again, like I was telling you, I think it's important to understand that sometimes, like I was told in medical school and during my residency training, talking to your patient is going to make a biggest impact rather than prescribing them a pill. Talking to them, helping them get through some problems is going to make, the biggest difference.
What techniques have worked for you as far as talking to the client? Let's go ahead and say that you have a client that that you can actually work with them. instead of having to prescribe them a certain medication, you could say, I can definitely work with this person so that I don't have to prescribe anything. What techniques do you use that are effective for them so that you can reach them and help them?
I guess the more useful one in the sense of the here and now is cognitive behavioral therapy, in the sense that you try to, understand what might be triggering a symptom, and like I was telling you earlier, help the patient pump the brakes, reorganize the thoughts, the feelings in order to prevent a behavior. That's something that we use a lot, and within the time frame that we have, because our visits are shorter. That's another difference between a psychiatrist and a psychologist or a therapist. Our visits are compressed.
A lot shorter.
Yeah.
Okay.
And we have to look over the meds, and we have to look over what's going on, and within that time frame that we have, I think that's useful. Now, when I have a little more time, let's say a patient that's, wanting to do something more in depth, we can do analysis, psychodynamic therapy, where you go and you start at the very beginning as early as possible.
Is that a Freudian thing?
Yeah.
Yeah?
Yeah. Yeah. Since your first memory, let's start there. Why not?
Okay.
And walk me through what's been going on.
Is that a bit more expensive, or is it something that insurance companies and
unfortunately, insurance companies won't pay for it if it comes from a psychiatrist. And that's one of the things that insurance companies and all these policymakers have changed the game so much that as a provider, then you're left with fewer options to treat. But that's something that I truly enjoy. Whenever I have a chance, and whenever my patients' times and my own time, coincide. That's something that's very, very interesting, because you can really see how, your earliest experiences as a human are manifesting now as an adult, perhaps.
As an adult, yeah. Yeah, you're right about that. Sometimes it is a little difficult to understand why we behave a certain way. And a lot of times that has to do with our upbringing too, right? Yeah. Dysfunctional upbringings.
Correct.
Drug and alcohol use, things of that nature, right?
I mean, there are studies even that, how our brain develops even in the womb. If the mom maybe drank a little bit or smoked or whatever.
Can you take a dive into that, Dr. Flores? Because I think it's important that people understand that it definitely affects in utero, right?
Yeah.
It affects the fetus when mom makes choices that are questionable, right?
Correct. No, it has to do with the fact of how our central nervous system develops. All these external insults, being alcohol, for instance, that's the most common one, I guess. It doesn't really allow for our brains to develop, for our neurons to connect the way that they should. So what happens, Marcelo, here is when you're growing up, this pruning of your brain gets interrupted, and some patients are proner to develop maybe more psychiatric disorders than others, because that development was sort of impaired in utero. And as then you're born and you're growing up, those connections weren't really made the way that they're supposed to. And that's what happens. We see that a lot with PTSD.
Yes.
I treat a lot of soldiers, right? And you think about it, both soldiers were exposed maybe to the same trauma in a war, but how come soldier on this side didn't develop as a severe PTSD as the one on the left? Why is that?
Yeah.
The one on this side, it has more resiliency. It's more resilient, and that concept.
But when you say resilient, though, his upbringing was a little more structured, maybe,
more
or was
structured, and even, like I said, these studies go back all the way to the womb, and they study it.
Yes.
How was the pregnancy when you were about to be born? What was going on? And they find that there are some variants there where they have maybe a little more impairments, and that's why they can't, they're not as resilient, because their brain, their neuronal connections are not as strong.
Okay.
And that goes all the way to that point.
Well, resilience plays a big role, I think, in just about anything having to do with mental illnesses.
Yeah.
How do we get people to understand that resilience is such an important factor here with post-traumatic stress disorder or depression or things of that nature? How would you introduce that word to a lot of people that maybe haven't heard it too much? When you're in the mental health field, it gets thrown around like nothing, right?
Right.
But when you're just trying to study and try to find out things about mental health, what exactly is resiliency?
Well, resiliency is the fact, like I said, that you're able to deal with adversity a little better than the person next to you. And it might be because you have a more structured psychological complex, Now, it's important to understand that it's not, a big part of it is your upbringing, like you said it. But what I try to tell my patients is that you can actually learn this when you're an adult. Yeah, I know that you went through a lot of crap growing up, and we're not discarding that. We're taking it into consideration. We're going to process it. We're going to work through it. And once you do that, you're going to become resilient to a lot of things moving forward. Because you're going to restructure that psychological complex that you have, and that's, I guess, the best way I can put it.
Okay, so one of the things that I really want to stress out also is that, I really want to make sure that a lot of people are getting the information that we're trying to pretty much give to them. La resiliencia, lo que estás comentando ahorita también, porque también se me hace muy importante que la gente también nos escuche en español también y sepa lo que estemos haciendo. ¿Qué significa eso, la resiliencia? What is resiliency?
Sí, bueno, es como platicábamos hace un minutito, esta es una manera de lidiar con la adversidad de una manera más sólida quizá que la persona que está enseguida de ti. A veces no quiere decir que seas mejor como persona, simplemente como que existe un complejo psicológico más sólido, más estructurado dentro de ti, que si te expones a un trauma o a una situación compleja, difícil, puedes sobrellevarla un poco mejor. Y a veces es importante remarcar que, puede venir desde pequeños, ¿no? Cómo estuvo tu ambiente familiar, cuáles fueron tus experiencias. Pero yo trato de enfocarme con mis pacientes de que también esto es algo que se puede aprender ya de manera más formal cuando eres adulto. No es algo que tienes que venir cargando desde niño.
Sí.
Obviamente es importante ese aspecto, pero a través de la psicoterapia puedes procesar mucho del trauma que has experimentado, muchas de estas experiencias negativas, y después de que ya te sientes más cómodo, cuando sigues hacia adelante te puedes afrontar a la vida y a los problemas de una manera, pues, digamos, con más herramientas, que te permiten, pues, no caer en ansiedad, no caer en depresión tan fácilmente.
Ok, perfecto. Y eso es bastante importante, ¿verdad?
Sí, claro.
So one of the things that we notice about a lot of the people is resistance también, ¿verdad? La resistencia. Y ya sé que hablamos un poquito de lo que viene siendo el estigma y la gente que de repente a lo mejor no quiere ver un psiquiatra o un terapista, pues porque, como dices tú, a lo mejor nos ven de cierta manera y esa etiqueta no lo quiten, ¿verdad? No la pueden quitar. So what kind of things would you say would help a person motivated to being able to get the help that they need?
Yo creo, si te soy sincero, cosas como estas, las que estamos haciendo.
Okay.
El tratar de hablar lo más abiertamente posible, lo más francamente posible acerca de lo que nos está sucediendo. O sea, es importantísimo promover este medio de acude con tu psiquiatra, acude con tu terapista. No tiene nada de malo, ¿no? Como dicen, no es una etiqueta. Quitar esa etiqueta y verlo como un problema que tiene una solución es lo importante, yo creo. Y obviamente toma tiempo, ¿no? O sea, no está tan facilito de que, ya voy a ir con el doctor y todo se me va a quitar. No, o sea, estas son cosas que llevan a veces meses, a veces años.
¿Se te hace más difícil trabajar con gente con los menores o se te hace más difícil trabajar con los adultos?
A veces con los menores, porque de cierta manera te das cuenta de que es un sistema familiar disfuncional. Y cuando llegan a tu clínica buscando ayuda, la familia siempre abandera al pequeño como, ese es el niño malcriado, es el que tiene el problema.
El que no se comporta bien, ¿verdad?
Pero conforme vas escarbando, te das cuenta de que, bueno, también son los papás y a veces es la abuelita.
Ándale, lo que la gente no quiere saber, ¿verdad? No quieren saber que ellos también forman parte de la culpa, ¿verdad?
Exacto. Entonces, es un trabajo difícil, muy difícil en mi opinión. Entonces, por eso, bueno, mi práctica se enfoca en adultos, pero también tengo oportunidad de ver a menores en alguna ocasión, ¿verdad? Pero es muy, muy complejo.
Do you talk to the parents about it? Do you talk to the...
Yeah, I do.
Yeah? So when you're having a session with the child or with the teenager, the parent is present too? El papá está presente durante la terapia?
They have to. I mean, we do ask their permission to see if we can, have a few minutes with, the minor so that they can maybe open up a little bit. But it's with their parents' permission, and they are present in the session most of the time. Because it's important to have them there. But I've had experiences, Marcelo, I can tell you, que han sido muy frustrantes, honestamente.
Talk to me a little bit about that, because I think that's really important also.
Por ejemplo, una vez, en una ocasión, sin dar detalles personales ni mucho menos, pero una pequeñita estaba batallando mucho, severamente deprimida, yendo al hospital psiquiátrico muy, muy frecuentemente. Y ya cuando hablaba con ella, me decía, es que mi papá toma mucho, llega muy borracho a casa. Y a mí me pone eso muy mal.
Sí.
Con razón, o sea, yo le decía, pues sí, ¿cómo no? Pues te estresas, te pones triste, no quieres ver a tu papi así.
Okay.
¿Verdad? Y cuando yo hablé con el padre de familia, le dije, mire señor, esto es lo que está sucediendo. Yo sé que usted a lo mejor está batallando, hay opciones, yo lo puedo ayudar a dejar de beber alcohol, o sea, porque esto está afectando muy severamente a su niña. ¿Y sabes qué me dijo?
¿Qué es lo que te contestó?
Yo no voy a dejar de tomar nunca. Le dije, entonces, ¿usted prefiere que su hija en algún momento se llegue hasta quitar la vida? Pero usted no dejar de beber, me dijo sí. Entonces, eso es también
difícil.
Muy, muy, muy difícil de llevar hasta para mí. Yo me acuerdo, trata uno de ponerse lo más serio, lo más profesional que puedas, pero son cosas que te afectan emocionalmente hasta a ti como médico, ¿no? Como terapeuta, como psiquiatra. O sea, es muy difícil, muy difícil.
Yeah, definitely. Like in those instances also, do you have to report that to Child Protective Services? If the father or the mother are not being compliant with taking them to the necessary doctor's appointments, for example, or if they have some sort of family dysfunction like addiction or alcoholism, and you were really adamant about them getting help and they don't get help, is that something that you also have to, are you responsible for reporting to?
Yeah.
Okay.
Definitely. We have to provide as many options, as many tools to, for the safety of that, minor that you're treating. But, unfortunately, more often than not, sometimes it doesn't follow through. And like I said, it becomes so frustrating because you see that, dysfunction between parents, kids, vice versa. It's very, very complex. But at the same time, like I said, if you're able to get through, it can be very rewarding, to see a real change within that nucleus.
Absolutely. Do you find yourself giving a lot of information regarding addiction, drugs, alcoholism, or even prescribed medication that people are addicted to those?
Oh, yeah. No. And this is not just within psychiatry. Whenever we go to the General Hospital, UMC, Del Sol, Providence, the literature, the evidence says that up to 25% of all hospital beds, general hospital, not just psychiatric hospital, are occupied with patients that struggle with alcohol abuse. It's just that we don't see it maybe, or we don't pay attention because it's legal.
Okay.
right?
Yeah.
Oh, a lot of people drink. Yeah, but let's talk about it. How much are you drinking? Is this creating a problem? So yeah, I mean, because it's impossible to treat maybe, a psychiatric disorder like anxiety or depression if you don't treat this other part, the alcohol or the weed maybe, that's, interfering with what you're trying to do. So it's very important to put it out there.
Yeah. Definitely. And it's important to educate, parents and families regarding all these things, right? But I still kind of find it very stigmatized. I find it that it's very difficult for families to get the help that they need to really make an impact in their family life.
Yeah.
And I find it that a lot of people find it hard to reach out for help when push come to shove.
Right.
So I think we have a lot of work to do as a community, for sure.
Definitely.
Yeah, for sure. And y como dices tú, este tipo de pláticas se me hacen muy importantes para que la gente se pueda saber de este tipo de temas también, ¿verdad?
Más que tenemos la opción de usar las redes sociales. Yo creo que cuando nos pueden hacer daño en algún sentido las redes sociales con tanta información negativa que vemos, pero si las sabemos usar y darles un spin positivo, de mandar un mensaje de, bueno, vamos a promover salud mental, vamos a promover esto, ejercicio, etcétera. Tenemos ese acceso.
Pero estás hablando de, bueno, vamos a decir, de la red social, right? Social media. Ahorita últimamente, ¿es un problema también? ¿Estamos viendo que es algo más negativo para los jóvenes que positivo?
Pues es que...
¿Tú lo has visto en tu clínica?
Claro.
Sí.
Pero por eso te digo, porque quizá si no tienes la estructura psicológica bien formada, pues te estás comparando con el de enseguida, o ves la foto del Instagram, que qué bonito viaje, qué bonito reloj y qué bonito carro, y se vuelve todo un problema, ¿no? Cuando realmente pues son imágenes que son de un segundo que no... te dan la historia completa, ¿no? O sea, la vida no es perfecta, la vida no es así, pero la puedes llegar a ver así y entender así, ¿no? Y es cuando se crea el problema. Pero a lo que voy es de que quizás si usáramos estas herramientas para otros propósitos, para ayudar a la gente. Bueno, si ya estás agüitado y te sientes triste porque pues estás viendo que tus amigos son más exitosos cuando no lo son, bueno, podemos buscar ayuda.
O que tus amigos se van de viaje.
Sí.
They're going to Hawaii, they're going to Cancun, right? And you're over here not taking vacation, right?
Exacto.
Yeah, that could take a toll. So do you see that that happens more with teens versus adults, or is it?
No.
Wow, that's a shocker right there.
I can tell you that even friends of mine that are physicians have talked to me about that.
Okay.
They're like, I had to close my social media accounts because I would see them making rounds in the hospital, and I would see you, maybe me, taking a trip, and I'm here working, and why isn't it me going there?
Yeah.
Why? And I'm like, it's just a couple of days, dude. It wasn't even that big of a deal. It's not.
It was 2 days.
Yeah. Like, it's not, I don't live my life like that, or another... people feel like, other people feel like you see what you see is what is actually happening.
Yeah.
But it's not true. It's not true. So adults go through that as well. They're like, I had to close it down. I can tell you that we've seen children, adolescents that spend, 12, 14 hours of the day glued to a screen.
Okay.
I mean, think about the damage that can, make to a brain, to a developing brain.
Yes.
And I'm not, saying that social media or phones or whatever are the devil. They're not. We just have to understand that they're a tool. It's there for a purpose, to help you do something. But it shouldn't be this, whole thing that your life revolves around. Oh, I can't go there because, I don't have battery anymore. Well, who cares? You'll get home and you'll charge it, and you'll take care of next day.
Yeah. It's easy peasy, right?
Yeah.
It gets a little complicated. Yeah, this and so many other things that are just times are changing so quick that a lot of people don't know how to shift with the changes. It becomes a little more complex for a lot of people, and understanding that, like for example, there's no rules, there's no type of manual that helps you maneuver in and out of social media.
Right.
In my particular case, I know that, I try to talk to my daughter and my son, try to limit their time on it. But I notice that if I don't say anything, if I don't put down any rules, regulations, si no les digo que ya basta, todo el día se la pasan ahí, desde la mañanita, si es posible, hasta en la tarde. ¿Verdad?
Yo lo he visto inclusive con algunos padres de familia que en vez de... Y digo, yo sé que el criar un hijo es extremadamente difícil, yo lo entiendo. Yo no tengo hijos, pero yo sé qué difícil es. O sea, es un trabajo exhaustivo. O sea. Pero no se trata de que, te va el teléfono y pues ponte a jugar. Y, pues no, ¿verdad? O sea, un ratito. Un ratito está bien. Pero no todo el día, como dices, hay que tener reglas, hay que tener pausas. Todo con moderación, ¿no? Como decimos.
Pues sí, todo con moderación.
Pero es difícil de llegar a hacerlo.
Sí, definitivamente les afecta en su desarrollo también. Y me da mucho gusto que pues también platiques con los jóvenes acerca de ese tipo de cosas también, ¿verdad?
Sí.
So what is it that you're doing right now as far as your profession and exercising your profession?
Okay, well, I work full-time at the Department of Veterans Affairs. Like I was telling you, I do treat, I'm very honored to treat a lot of veterans that have served in our armed forces.
Okay. And we do thank them for their service.
Yes, thank you.
Today is their day, right?
Veterans Day, thank you for their service to all of them. I'm greatly honored to at least help a little bit. So I do that full-time. And then we've opened up a clinic, a psychiatric and therapy clinic on the east side of El Paso, mental health center.
Okay. That's exciting.
Yeah, I partnered up with Viridiana Ortiz, who is a clinical social worker for psychotherapy.
Oh, nice. Okay, cool.
And I partnered up with a friend of mine, a very dear friend of mine. Viri is also my friend, of course. We're all friends. Dr. Ramon Aragon, who is another psychiatrist. Okay. He works out of Austin, but now with the advantage of telepsychiatry, he helps us a lot with our patients in El Paso.
Okay, so he's going to be doing therapy? Is that what he's going to be doing?
No, he does med management.
Oh, medication
So
management.
medication, like myself, but he's based off of Austin, Texas.
Okay, so this is a service you're going to be able to provide families of El Paso.
Correct.
Are you also going to facilitate case management, or is it something you're going to work into? Later on?
We want to incorporate new services, collaborations with Marcelo, maybe. Right?
That'd be great. That'd be awesome.
Yeah, most definitely. It's brand new, so we're kind of getting our ducks lined in a row. But we're super excited, and we want to help the community here in El Paso, a la comunidad en Juárez, tratar de hacerlo lo más relajado posible, porque eso es importante, que vengan a la clínica y que se sientan cómodos.
Y que se sientan con la confianza también, porque la verdad, cuando se platica en una clínica, cuando se platica en un hospital donde estás trabajando, yo quiero que la gente tenga la confianza de que todo es confidencial. Everything's 100% confidential. And I really think it's important that we stress that, because I think that in our community, a lot of times they're afraid to be seen by somebody else, or they're afraid to get that label, like you said. But it's definitely something that's a necessity in our community. We have to let people understand and know that we're here to help them out. Where's this clinic located? I know you said the east side.
East side is 2150 Traywood, between Lomaland and Lee Trevino.
Okay.
It's right next to that old golf course, Vista Hills.
Vista Hills,
right next to it. It's the buildings right next to it. Okay. 2150 Traywood, Suite B's 161. And their phone number is 915-832-1702.
Can you say that one more time?
Yeah, 915-832-1702.
Awesome.
Yeah.
That's great.
Yeah.
Well, yeah, people are definitely going to need this, and they're definitely going to benefit from something like that. I know this interview was kind of random, and I thank you for accepting last minute that you're coming in to do this podcast. But for me, it was a step in the right direction. I know there's a lot of things that we're fixing right now, but we want to get the information out there as quick as possible to people. That way they feel the confidence, like I mentioned. And where can they find you on social media?
Well, my social media portals are pretty straightforward. On Facebook, it's just Roberto Flores. You just do a simple search and I should come up. My profiles are open. And on Instagram is the same, Roberto_Flores_MD. Again, they're public and you can join. I like to talk about things like the ones that we did today. If you have a question, I try to answer within HIPAA and within the regulations, right?
Claro que sí, en las reglas. Para nuestros hermanos también de Ciudad Juárez que a lo mejor están viendo también este programa, para que ellos también te encuentren.
Sí, trato, como te digo, de estar lo más disponible que pueda y no sé, hasta ponerlos en la dirección correcta si están buscando algún servicio que yo no pueda brindar. Tratar de ser un asset para nuestra comunidad, ¿no? Una ayuda.
Okay.
Yo quiero ayudar.
¿Referencias para personas que viven en Ciudad Juárez que no vienen para acá, tal vez?
También, o que quieren venir al Paso y quizá, bueno, no tengan su seguro. Pues hay muchas opciones, ¿no?
Ok, perfecto. Entonces te quiero dar las gracias.
No, hombre, a ti.
Por estar aquí. I really think that this is a really good thing for the community. So I thank you for being here. And I know you're very busy. You have a lot of things on your plate. But the simple fact that you've taken time out of your day to be here with us and be able to talk to people and having them get to know who you are, I think is probably the most valuable thing today.
No,
sure.
Thank you. It's truly an honor. And whenever I can help you, you know that I'm always game. So.
Awesome. I appreciate it, my man. Thank you.
Thank you so much.
All right, thank you. Thank you for watching today's show, the LHP podcast. If you would like to support our content, please hit the like button on YouTube. We're also on Instagram, Facebook, TikTok, and any other social media platform. I'm going to leave a link at the bottom. Thank you for watching.